Good evening, I'm Saul Sainz, and this is ABC-7 Extra Sunday edition. News of the vaccine against COVID-19 gives El Pasoans hope there is light at the end of the tunnel. More than 800 people have perished at the hands of this invisible killer. As many as 9 mobile morgues are set up outside the El Paso Medical Examiner's office filled with loved ones. Inmates are being used to help move some of the bodies. COVID-19 continues to spread throughout the borderland. The only hope this virus will leave is when the vaccine is made available. Thursday, the head of the El Paso Health Department announced preparations are being made ahead of time so that when it is available, vaccinations can begin right away. Healthcare workers are in the front lines. Caring for the sick will be the first to receive the vaccine. The elderly and most vulnerable population will be next. Tonight, we hear from Texas Department of Health Services as well as from the director of the El Paso Health Department. Right now, there are several drug companies reporting they have developed a vaccine that can fight COVID-19. I'll ask my guests what the timeline is to receive that vaccine, where it will be stored, and where people will get that potentially life-saving immunization. ABC-7 reached out to the Texas Department of State Health Services, and they're working with one of the drug companies, Pfizer, that made a breakthrough in developing a vaccine they say is 94% effective in battling COVID-19. We asked the state spokesman just how this vaccine will be distributed throughout Texas cities.
This isn't a situation where the vaccine is going to be shipped centrally to us at the state and then we send it out, which is a good thing. It's going to be a little more flexible than that. So how it's going to work is that we're going to learn from the CDC every week or every couple of weeks how much vaccine and which different vaccines are coming to Texas. And then we're going to tell them where to send it. And then either Pfizer is going to ship it directly or the CDC's distribution contractor is going to send it out to those end users. So it's going to go directly to the doctor's offices, the hospitals, the nursing homes, the other places that are going to be actually giving the vaccine to people. So along with the supplies that they need too, like needles and syringes and alcohol prep pads and all of those kinds of things that are needed to give vaccines. And so that's going to be shipped directly from the federal government to them, kind of as we tell them how to do it. So that should help streamline things on our end a little bit and make sure that that vaccine gets to the people who need it as quickly as possible, as well as, you know, keeping that cold chain, which is going to be important because the vaccine has to be shipped either frozen or refrigerated to make sure the vaccine's still viable. And so the fewer hands it has to pass through, the better.
Joining us now to talk about how El Paso will receive those vaccines, because I understand we're talking plural, not just one, is Angela Mora, the director of the El Paso Health Department. Ms. Mora, thank you so much for taking time to talk to us this Sunday. We want to talk about when we're going to get these vaccines, how we're going to get them, and how it's going to be distributed.
Well, I'm going to repeat what the SHS official said. So we've been working very closely with the Department of State Health Services. We meet with them on a weekly basis on planning for the distribution of the vaccine to El Paso. We also have been meeting with Pfizer representatives so that we can understand from them how exactly the vaccine is going to be shipped to El Paso. So right now, we know that there's a second pharmaceutical company that is coming on board. It's going to probably submit their application for emergency utilization approval from the FDA. And what we know is that now the process for dispensing the vaccine is open to all the eligible service providers in El Paso County, in any jurisdiction. We have approximately 139 agencies that have signed up to be vaccinators, to be dispensers of the vaccine. So we know that from Pfizer that they are going to ship containers with a minimum of 1,000 vaccines to each one of the providers. The providers need to be ready to follow the cold chain, as the gentleman said, and also to be able to dispense those vaccines within a short period of time, particularly if they are not buying the whole high cold storage containers. They are going to keep them on the shippers, and they need to make sure that they dispense those vaccines within a very short period of time, which can be from 15 to 18 days. So each one of the, as the gentleman said again, we are identifying at the local level the priority populations, so the vulnerable populations that are going to be immunized in the 3 different phases. in which the vaccine is going to be shipped to jurisdictions. The Public Health Department, we are going to be mapping those locations to ensure that if we identify any gaps in serving the population, that we fill that gap through our resources.
Right.
So
Ms.
up
Mora.
to now, we have 7 vaccine clinics that are going where the vaccine is going to be administered throughout El Paso County. We have the capacity right now, those drive-through locations, to inoculate approximately 240 individuals per day. So you multiply that by 7, and that is going to give us a nice number. But we still have to bring in, determine the number of vaccinators each one of the local providers is going to have, so that we can do the math and determine what capacity we have. So as we know, the first phase, the shipment of the first phase is going to be only to inoculate the frontline workers, healthcare workers in particular,
Right.
and some of the elderly population, people with underlying medical conditions.
Right. Okay. We're going to take a really quick break, but we're going to continue the conversation. You're watching ABC-7 Extra. When we come back, the city has prepared a questionnaire for El Pasoans. The main question on that questionnaire is if you would take the vaccine once it's available. If not, why not? I'll ask Ms. Mora what other information they're trying to get from El Pasoans. You're watching ABC-7 Extra, where news comes first.
Introducing new Wingstop Thighs. That's right, Wingstop Thighs. That means lemon pepper thighs, mango habanero thighs, spicy Korean Q thighs, all our flavors, now on thighs. Wait, what about the wrench? Nice. Get them while you can.
Scams are an everyday threat and are becoming increasingly harder to spot. At El Paso Electric, we want to protect our customers from becoming a victim. If you're suspicious of a person claiming to work for or with El Paso Electric, either on the phone or at your door, stop. Call us using the number from your electric bill and verify the information you've been given before you pay or sign anything. Know that El Paso Electric will never ask you to make a payment over the phone or in person. If you're suspicious of a scam, remember to stop, call, and verify.
Hi, this is Armando from Jewel Gallery, and 'tis the season to get engaged. Verraggio's Parisian, Venetian, Couture, Renaissance Insignia collections allows you to select the engagement ring of your dreams. From Venetian lacework and French beading to Parisian wraps and rose gold couture inlay, it's never been easier to select a unique engagement ring or wedding band that has the cutting edge with that classic foundation. The possibilities are endless when it comes to Verraggio. White gold, rose gold, yellow gold, platinum. How will you express yourself? Make it yours. Come shop the exclusive line Verraggio. Unlike any other ring, only at Jewel Gallery, the jewel of the West Side, 7134 North Mesa, 845-7740, Jewel Gallery, where it's all about the ring.
Introducing new Wingstop Thighs. That's right, Wingstop Thighs. That means lemon pepper thighs, mango habanero thighs, spicy Korean Q thighs, all our flavors, now on thighs. Wait, what about the wrench? Nice. Get them while you can.
Welcome back to ABC-7 Extra Sunday Edition. We know healthcare workers on the front lines, as well as the most vulnerable population, the elderly and those with underlying health conditions, will be the first to get the vaccine. But what happens thereafter? We get more from Texas Department of State Health Service spokesman Chris Van Heusen.
We want to make sure we have good coverage around the state as far as urban and rural areas, all kinds of different communities. And so we're encouraging providers to enroll with us. You have to enroll with the SHS to be eligible to receive the vaccine because it will all be coming through the state and federal system. We have more than 3,300 providers enrolled so far, so that's really good in more than 200 counties. So we have pretty good geographic coverage right now, but we, of course, always want to expand that. And, it will be into next year, probably a few months into next year before the vaccine is really widely available in all of those locations. So there's still time for providers to sign up and be able to take advantage of being a COVID-19 vaccinator and getting that vaccine to their employees, their patients, and other folks that they work with. But we have an expert vaccine allocation panel that's going to be making those decisions and recommendations to the Commissioner of Health. So they will be looking at, the number of those particular populations, how many healthcare workers, how many elderly people, people with chronic conditions, where are they located around the state, who can handle the different kinds of vaccine because there are different shipping and storage requirements with each one. As well as some of the socioeconomic factors as far as making sure that people who may not always have access to healthcare will be able to get the vaccine. So all of those things will be going into what this expert panel is considering. They'll make recommendations to the Commissioner of Health, and then he has the final say, and we make that request to CDC and let them know where to send the vaccine.
I also want to welcome back to ABC-7 Extra Ms. Angela Mora, Director of the El Paso Health Department. Welcome back. I want to ask you, Ms. Mora, you have already established a questionnaire as well that you'll be sending out to El Pasoans. And one of the questions, obviously, is whether or not you will take the vaccine. What are some of the other questions that you'll be asking El Pasoans?
Well, we want specifics. If the individuals tell us that they are not interested in taking the vaccine, we want to know why. Is it because they are afraid of the side effects? Is it because they think it's going to be expensive? Is it because they don't trust the system and they don't trust the vaccine? So we need to determine primarily why, whether or not they're going to they're interested in receiving the vaccine, and if not, why, so that we can outreach to the community, provide additional information on the safety of the vaccine, and just try to address the issues that are going to be challenging in terms of us making the vaccine accessible for the community.
Let's answer two of those questions. A, the side effects, and B, the cost.
Yes, the side effects, there's 6 different pharmaceutical companies right now that are competing for the vaccine, right? So we know that what we know from Pfizer is that the side effects can last for sometimes a few days because it's going to, the individuals might feel some symptoms, some might feel a little tired, and that is going to linger for a few days, but then they go back to normal. And that is based on the clinical studies. They made those observations. So we, from Moderna, we don't know yet what the side effects are. We haven't had a chance to talk to any of the representatives, but we will find that out as well.
And the cost?
The cost, it's with the Department of Public Health, is going to be totally free of charge. But I understand that the medical providers, they can charge an administrative fee up to $20. We can confirm that with the Department of State Health Services, but this is usually the amount that is allowable for healthcare providers to charge, and that is administrative cost is for them to be helped with the cost of their employees they're going to be utilizing to administer the vaccine.
Okay. I want to give you some insight as to some of the polls that were taken. ABC and Washington Post conducted a poll back in early June. That poll asked Americans if a vaccine that protected you from the coronavirus was available and free, would you take it? 71% of adults said they probably would. 27% of Americans said they probably would not. Do you believe that perhaps minds have changed now that we're further into the pandemic, Ms. Mora? Do you think more people would be willing to take the vaccine now that it's obviously ravaged the country and it's taking quite a toll here in El Paso?
We sure hope so. We have talked to a couple of hospitals, and they have taken a poll within the healthcare workers, which you would expect everybody wants to take the vaccine, but they found that approximately 60% of them said they would take the vaccine and 40 said they wouldn't. We don't know how people are going to react. I know during H1N1, we had a very large number of people who were interested in taking the vaccine. And I trust that, knowing the El Paso community, that a lot of them are going to be interested, and they are going to go very quickly to the facilities to have the vaccine administered, but only time will tell. But hopefully the survey that we're conducting right now is going to gauge the interest of the community and perhaps be effective in encouraging them to take the vaccine once it's here.
Okay, we're going to take another quick break. You're watching ABC-7 Extra. Still ahead, we hear once more from the State Health Department about the vaccines they're hoping to get once approved by the FDA. How soon will the general population get that vaccine? I'll ask. We'll be back.
Whataburger now delivers, which means you can get your favorites delivered to your door. And this favorite delivered to your door. And this one. And this one. Simple as that. Whataburger delivery is here. Use our app or order at whataburger.com.
Wow, a new Buick for me?
To James from James. That's just what I wanted.
Is this a new Buick?
I Secret Santed myself.
I shouldn't have. I have been very good this year.
Wow. Wow.
Wow.
Don't forget you this holiday season. Get an SUV from Buick.
Get $3,500 purchase allowance on this 2020 Encore GX, or pay no interest on most 2020 SUV models. See your El Paso Las Cruces Buick dealers.
Black Friday starts this Wednesday at Conn's Home Plus. Save up to 55% or more on Black Tag electronics, like this 70-inch LG TV for only $499.99. Or save 63% on an HP laptop. Get free furniture pieces and a free 65-inch 4K TV with a qualifying furniture purchase. Plus, pay 0 interest on everything in the store. Get all the stuff you want with low payments over time. Black Friday starts this Wednesday at Conn's Home Plus.
Are you ready for a better burrito? At Rita's Burritos, every recipe is made from scratch, and our hand-rolled tortillas enhance the freshness and authentic Mexican flavor in every bite. See what everyone's talking about. Rita's Burritos comes home to El Paso, 4907 Crossroads on the west side.
For unique styles and designs in contemporary furniture, EP Furniture Guy has what you're looking for. Let us help create the comfort you desire for your home. You'll find the right piece at the right price. EP Furniture Guy, 3402 Durazno. Visit us online and like us on Facebook.
Ultimately, it will be up to El Pasoans to take this vaccine in order to stop the deadly virus in its tracks. We turn once again to the Department of State Health Service spokesman, Chris Van Heusen.
The vaccine isn't going to do anybody any good if people don't actually take it. And so that certainly is one of our concerns. We want to make sure that we are sharing the latest information we can. The manufacturers and the FDA are dedicated to sharing all the data, the safety data that they have to help reassure people. This vaccine, no doubt, let me say that again. All of these vaccines are being developed very quickly, but they are still going through the same process, the same steps that any medication, any vaccine would need to go through. So sometimes those are happening in parallel, but it's the same clinical trials. And in fact, these are very large clinical trials, tens of thousands of people for each vaccine. And so they have a really broad-based, data on both effectiveness and safety that they can look at. And we haven't heard of any, really severe reactions to the vaccine. There are always going to be some side effects. But, those seem to be minor or moderate in these cases. And we'll learn more about that as the FDA gets and releases that data from the manufacturers. So, that's going to be important. We want to be able to share that information, and we'll certainly continue to do that as we learn more about the vaccine. We'll be launching in the new year a public education campaign talking not only about the COVID-19 vaccines in particular, but really just about vaccine safety and vaccine effectiveness in general, just helping people understand what the process is, how those vaccines are approved, and the track record that they have. So it's certainly something that's on our radar and something we're going to keep talking about because it is so critical. Getting vaccines and getting enough of Texans vaccinated is going to be the best way we can turn the corner on this pandemic.
I also want to welcome back to ABC-7 Extra, Angela Mora, Director of the El Paso Health Department. I want to ask you, when people tell you, or at least the people that you've gotten responses to that questionnaire, when they say that they're not willing to take the vaccine, what are some of the reasons that they've given you so far, or that they've given the health providers? Because I know you got this information from some of the hospitals. What has been the reason thus far for not wanting to take the vaccine?
Saul, we still don't have enough data to analyze. We just posted this survey on EP Strong this week. The information that I received from the hospitals is an informal information. We have an analytics group from UTEP who is going to analyze the data for us once we start receiving it. We're checking on a daily basis to see what the responses are, but we're not there yet. So what we're planning on doing moving forward, once we get the results and analysis of the data, that is going to direct our interventions and the messages we're going to direct to the community. We will do as much education, do a lot of information on a regular basis so that the community know the safety of the vaccines and to see what reactions we're having with those who are receiving the vaccine. For hopefully everything is going to be positive, and individuals, as we move forward toward the second and third phase, when we're going to get a large number or enough vaccines for everybody in the community, that by then people will totally trust the vaccine and really come out and get their vaccine.
When do you anticipate we will go to phase 2, then eventually phase 3?
We anticipate going into phase 2 probably at the beginning of the spring. If the first shipment begins, as is being stated, mid to the end of December, then most likely we'll be able to, by February, receive the shipment of phase 2, probably late February. And then not until the summer is when we have been told to expect the shipment of the third phase, which is the largest number of vaccines that we are going to receive. Now, everything, they keep reminding us from the state side that everything is still not solid. Everything is very fluid at this point. So the plans change on a weekly basis, sometimes daily basis. And perhaps we're going to get the vaccine a little earlier than expected. But in any event, we are ready at the Department of Public Health, and I think the community in general, to receive the first shipments of vaccine and dispense it appropriately to the selected populations.
Now, let's talk about the storage of the vaccines, because I know that the city used CARES Act dollars to purchase some buildings. Will these buildings be used to either vaccinate or to store some of the vaccines?
No, we have purchased storage units for each one of the 7 vaccine clinics that we are going to have available. And the equipment is going to be at each one of these facilities for all types of vaccines. So the shipment of the vaccine is going to be directly to the enrolled facility. So for example, we are one entity, City of El Paso, Department of Public Health, but we have 7 facilities. We have to enroll each one of those facilities. And each one of the facilities is going to receive its own shipment of vaccines to each one of those facilities, and we're going to store them at that facility as well.
Will you be taking that vaccine?
Absolutely. I'm going to be first on the line. I qualify because I'm over 60, and I plan to serve as hopefully a good example for the rest of the community, but I'm ready to take my vaccine.
So I'm going to ask you right now if I'll be able to bring my camera and record you as you're taking that vaccine, and hopefully that vaccine will be in the arm.
Absolutely.
Okay. And so from that point on, as we continue to vaccinate the rest of the population, is there hope, or at least what is the percentage of your hope, that we will totally eliminate and abolish COVID-19 from El Paso, the borderline in general?
You know, Chris, as with other viruses, we are not able to abolish a virus 100%. Like H1N1 is still there, and then you know that when we take the flu vaccine, we are also immunized against H1N1. So we expect, based on previous experience, that we're still going to be seeing COVID cases, but not at the magnitude that we're seeing it right now. It should be, you know, a handful of cases like we see now with H1N1 and with flu. Flu is a little more than H1N1. But it's always, every season is very manageable.
Yeah. Since we're obviously talking about seasons, if we don't get that vaccine anytime soon and we have the flu season together with this pandemic, what sort of situation are we talking about? Are we talking about a twindemic?
It is. So we have, yes, absolutely. So we could have 2 pandemics at hand that we would need to manage. And as we know right now, is extremely important because flu is overlapping with COVID. It is extremely important, since we have preventive measures to prevent the flu, that we receive our flu vaccine so that we can protect ourselves from any complications that are going to require hospitalizations. Our hospitals are overburdened right now, and we need to do whatever is necessary, do our part to ensure that we don't further overwhelm the healthcare system. Right now, the Department of Public Health is offering vaccines, flu vaccines, for free. We are going all over El Paso County to provide the vaccines at open points of dispensing. And as a matter of fact, this Saturday, we're going to have another open point of dispensing for vaccinations.
Okay. Ms. Angela Mora with the El Paso Health Department, thank you so much for taking time to talk to us. I appreciate it.
My pleasure. Thank you.
Enjoy the rest of your evening.
Likewise. Thank you.
Now, news that a vaccine is on the way is no excuse to stop wearing your mask. It not only protects the person wearing it, but others around them, like your loved ones. Also, remember, this Thanksgiving will be unlike any other we've ever had. I urge you to spend it away from your loved ones so you can spend Thanksgiving 2021 safely with them. Thank you for joining us. I'm Saul Saenz, and this has been ABC-7 Extra Sunday Edition. Good night y buenas noches.